Hello guys, this is Dr. Pal Manikam. In this video, we're going to talk about the most important topic that many people don't want to talk about, which is constipation. I completely understand what you're talking about. Should we really talk about this? Yes, absolutely. You should know whom to call when the nature doesn't call you. Let's dive deep into it. First and foremost, I'm going to break the myth that going to the bathroom every day is a mandatory thing for your good gut health. That is absolutely not true. Every patient is different. Every patient's brain gut axis is wired differently. If you're having a bowel movement once every 2 days, that is completely normal for you, might be. But if you're having a bowel movement once in 2 days and now it is being extended to once every 4 days or once every 5 days, then that is a problem of constipation. But if you're somebody who's going every day and now you are having once every 2 to 3 days bowel movement, then you should be concerned about it. My patient Arugusami is asking, Doctor, I used to have one bowel movement every 2 days. Now it is once a week. Is there any problem with my bowel movement? I said, hey, there is no movement at all, Ra. It is complete traffic jam. Bowel halt. Most people think constipation is because of lack of water intake, but more importantly, lack of fiber intake. Everybody should get at least 25 to 35 grams of fiber per day. Hydration helps, but fiber trumps in treating constipation compared to water. My friend Sarano Kumar eats parota, drinks hot water and marches in the hall to induce bowel movement as if he is participating in a Quit India movement. No matter how fast he does his march past, his bowel movement is a thing of the past. Of course, it's not only about lack of fiber, some neurological problems. Anything that is dealing with your brain-gut axis, your constipation can worsen. For example, in patients with diabetes, when they have increased blood glucose levels, one of the most common complications is affecting the nerves. So when that happens, the nerves to the intestine can get affected, the colonic motility can get decreased, which may result in constipation. Similarly, other neurological disorders like stroke, Parkinsonism, multiple sclerosis can also have brain-gut axis problems, leading to constipation. And the most important problem that you should be aware of is growth of a precancerous colon polyps inside your large intestine, blocking the bowel movement. This is called obstructive cause of constipation, and that is why we recommend colonoscopy for anybody who's turning 45 to 50 years and above. So it doesn't mean that you need to get a colonoscopy right away if you have constipation, but if things are not getting better, endoscopy is indicated. Polyps blocking the stool is like the goalie blocking the soda, but the problem is you cannot keep pushing it hard to release, unlike goalie soda. Another most common cause is medication use. I strongly urge you to review your medication list and then see whether any of the medication side effect is constipation. The most common medication that I usually see in the practice is oral iron tablets and any sleeping medication which can disturb the brain-gut axis. My patient Arugusami is saying, Doctor, my medications are causing me constipation. When I review the medication, he's taking the medication for constipation. So decreased frequency of a bowel movement is one of the symptoms of constipation. The other symptoms include incomplete evacuation, feeling like there is still left behind even after using the bathroom, hard or dry stools, straining and using physical maneuvers to get the stool out of the colon. All these can be a symptom of constipation. If these symptoms persist more than 3 months, this is called chronic constipation, for which you should seek medical attention. So when you should see a doctor, there are 3 alarming signs. One is when you are noticing blood in stool. Number 2, unintentional weight loss. You are not planning to lose weight, but you are losing weight, and that is an alarming sign. Number 3, family history of colon cancer. If you have any history of colon cancer in your father, mother, brother, sister, then you are at an increased risk, so we should seek medical attention. In those situations, a simple colonoscopy can actually diagnose and sometimes treat the disease as well. Endoscopy is nothing but gut indoor photography session after your gut is engaged with ultra processed foods. Go fiber with your gut. If not, the tube will go through your gut. Oh no! 3 things that will help you relieve constipation. Number 1, behavioral change. So under behavioral change, you can tap into your natural circadian rhythm where your colonic motility is high after meals, especially in the morning. So you can try defecating after meals, enjoying the advantage of the colonic motility. And number 2, don't rely too much on laxatives. If you have to take a tablet every day to induce bowel movement, then you might have to revisit what you're doing. For many people, they cannot poop without drinking coffee. Anything can happen over a cup of coffee, but bowel movement happens over a cup of coffee most of the time. I'm going to tell you the single most important factor for worsening your constipation, which is taking your mobile phone to your restroom. When you're having a bowel movement, your attention should be in the bowel movement and should not get get diverted into other actions like watching the phone, watching the reels and everything, because the whole defecatory movement is very complicated. The signal should get from brain to the large intestine. The sphincter muscle should relax, and it should be relaxed at the right time where you have access to the bathroom, and the signal should keep on repeating so that all the bowel movement is expelled out of the colon. For this, you will need attention to get the brain gut axis going. Very important. To get all this right, either you should have a strong brain gut axis. If not, you should not have anything on your hand while you are sitting on that toilet bowl. My friend Saranakumar's wife Tirupura Sundari keeps complaining that he's always in the bathroom spending hours to have a bowel movement, and he is watching the reels on his phone about how to cure constipation. Only his phone signal is very strong, not his brain gut signal. And the last thing under behavioral changes, try to use an Indian toilet as much as possible. I understand that in the US or any other countries, it is very difficult to adopt an Indian toilet. So if you're having a Western toilet bowl, you can have a stool which will elevate your legs, open up the defecatory angle so that the bowel movement gets better. So the second category of treatment is diet. As usual, food is medicine. Diet can completely cure your constipation provided you take care of it properly. The most important thing is 25 to 35 grams of fiber per day. I'm going to tell you 3 charming fruits that works as a magic in most of my patients. This is a magic fruit for constipation. It was originally found in China and then later cultivated in New Zealand, gaining worldwide popularity. Yes, it is kiwi. It is called Chinese gooseberry. It is rich in vitamin C, vitamin K, polyphenols and antioxidants. Both the flesh and the skin are edible, contributing to the high fiber content. One medium-sized kiwi almost contains 4 grams of fiber in it, and more importantly, it is tasty. Why this is very important in constipation is it contains an enzyme called actinidin, which helps in protein digestion and also stimulates the colonic motility, which will help in your constipation. Kiwi is a natural, gentle remedy for constipation patients, especially if they have IBS or for elderly patients. In a randomized control trial, kiwi worked beautifully for constipation without causing bloating or any abdominal discomfort, unlike other fiber supplements. My friend Saranakumar doesn't prevent kiwi fruit for constipation, saying kiwi players does not deliver when needed. Number 2, guava. A very cheap fruit but excellent in fiber content, which will promote your gut health. It is widely grown in tropical and subtropical regions, with 100 grams of a fruit giving you 5 grams of fiber. One guava is only 5 rupees compared to 35 rupees for a kiwi. It is a wonderful source of prebiotics supporting your beneficial gut bacteria. It has a low glycemic index between 12 to 24, which makes it a wonderful fruit for diabetics. It is also rich in antioxidants and vitamin C, reducing the inflammation in your gut. Did you know that Uttar Pradesh is the largest producer of guava in India? I really wonder what will the gastroenterologists do in that state, because they will not have any patients at all. I told my loyal subscriber Subramani that guava with red flesh inside may have a higher nutritional value. He gets the white one and turns it into red by applying Maggi masala powder. The third fruit is avocado or butterfruit. Avocado is native to Mexico and Central America, but now it is widely grown in India as well. It has a creamy texture, and that's why it's called butterfruit. It is rich in monounsaturated fatty acids, which is a very good source of healthy fats to you. It is packed with vitamins, vitamin C, vitamin E, vitamin K, potassium, and also antioxidants, which is a beautiful fruit for you. It contains lutein and zeaxanthin, which will help your eye health. It is very high in fiber. One medium-sized fruit can contain 10 grams of fiber, which is absolutely phenomenal. But the only problem is, because it is rich in monounsaturated fats, it can be rich in calories as well. So if you're on a calorie deficit diet, you need to be a little bit careful. This is one of the costliest fruit in India, with one fruit costing approximately 100 rupees per fruit. It's best to start with half an avocado and then slowly increase to prevent bloating and discomfort. My patient Arogyasami's constipation cleared in shock just after hearing the price of avocado. In addition to consuming foods with rich fiber, patients can also add 2 to 6 tablespoons of raw bran, which might also increase your fiber intake. It is usually followed by a glass of water or any other beverage of your choice, but make sure that you add bran slowly so that you don't develop significant bloating right away. These Gen Z guys are very notorious for all these acronyms. I asked them to eat bran. They're asking me, is bran is the shorter form of brandy? The most important problem when you are increasing the fiber fiber intake through diet to improve your constipation is significant amount of abdominal bloating, because your gut bacteria is not ready to digest this much amount of fiber right away. So you need to adjust your fiber intake accordingly, and you have to go down on the requirement if you are experiencing abdominal symptoms. But invariably, I can guarantee you that if you work on it slowly and steadily, you will reach your fiber content goal eventually. My patient Arukesami is complaining 24/7, 365 days, I feel always bloated. I said, hey, that is not bloating, that is your belly. Look carefully. Other quick fixes that might help, I will just list down, and you can jot it down and you can practice it whenever you need it. Number one, abdominal massage. Abdominal massage works beautifully, and many of my patients have gotten significant results. One of the most important technique that I tell my patients is to do the Malasana pose. It's a yoga pose where you spread the legs and use your hands to give the massage pressure on your abdomen. Or you could gently massage your abdomen in a clockwise direction slowly as well. Number two, probiotics. As I always say, don't go for probiotic supplements. It is always better to include natural probiotics like kefir, kombucha, curd, idli, dosa, dokla. Probiotics will enhance your gut health, improve your brain-gut axis, increase your constipation outcome. And number three is exercise. Exercise in any form will directly stimulate short-chain fatty acids in your large intestine, which is a beautiful food for your good gut bacteria. And again, the brain-gut axis will be strengthened, so the colonic motility is restored to normal. So please start exercising, mainly strength training. If you're not able to do that, at least walk 10 to 20 minutes after each meal. I'm so happy to introduce to you a new holistic program that I passionately put towards. It is called New Me. If you come as old you, we will give you as new me. This is a holistic program. I have been obese before, I have been overweight before. I tried multiple testings, treatment options, dietary options, and I exactly know now what are all the problems that I face. So if I was a patient, what will I need to cure my problem? Exactly those issues have been taken care of in this program. Please check out the pinned comment and then get to know more about the program. If you're interested, please send us a message. We'll be more than happy to take care of you. This program is not only for weight loss, we also treat patients with diabetes, hypertension, PCOS, fatty liver, and I am very excited because this is exactly what I want every doctor to do. No supplements, no artificial thing, just natural, no quick fixes. If you put the hard work, we will help you achieve your goal. So in this video, you must have learned about some tips and tricks to manage your constipation. Please check out our non-profit organization called Vannamalagal Foundation. We support patients with 60+ years of age and less than 6 years of age with special disabilities. We offer them 24/7 clinical care, and I am asking you to support us so that we can grow together. We can make this community a better place to live in. So remember, one belly at a time. It is absolutely important. Stay happy, stay gutsy. May gut bless you.